most famous physical therapist on the internet.
Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So what exactly does a TENS unit do for pain? We're talking about transcutaneous electrical nerve or neuromuscular stimulation.
That's a mouthful.
That's a mouthful.
TENS is easier.
And we'll get into that in just a minute. But if you are new to our channel, by the way, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also go to bobbrad.com. Go to the giveaway section. This week we are giving away a TENS unit.
Oh, yes.
So we're going to give away actually the 8080. That's our favorite one. I'll talk about why it's our favorite a little later on.
That's a model of the TENS. Yeah.
Yes.
You'll see.
You can also find the giveaway on Facebook. It'll be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program where we don't ramble.
That's right.
And Brad, what else do we have?
Well, now we do have podcasts out there, and it's more than just us on there. We've got excellent people from authors,
really great interviews,
experts. Carry on, Bob.
Okay, so we're talking about TENS unit. It's a small battery operated device, and it can be used to treat pain.
Right.
Especially if you're on any narcotics or prescription medication.
And you want to get off of them.
You want to get off or maybe use them less.
Sure. Yep.
This is the thing for you to try because it's going to be less expensive and it's going to be less harmful to your body. It really has no contraindications to a large extent. I mean, if you have a pacemaker or something like that, but
right.
You'll want to read on their website probably what the contraindications are or what the precautions are. So how does it work? So it creates electrical impulses. And Brad, do you want to show how you got it pulsating right now?
I've got this hooked up to my deltoid area. Let's say maybe I had shoulder pain, impingement problem or whatever, and I wanted to manage it. I've got two pads, and that equals one channel.
Right.
Electricity goes through one wire through, and actually it goes through your body. It's a very small amount of current. It's not going to injure you. You can adjust the intensity
and the mode. There's different modes.
Right. Yep. And
you can see it pulsating there.
Right. You don't have to set it so it pulsates the muscle. We're doing it so that you can see that it's on, and it can
actually
do that.
Works.
Yep. Exactly. So you would, if this was the case, you would set it up like this. I've got it set for 15 minutes. It's already down to 12. This I would
stick in your pocket.
Stick in my pocket. I'd route the wire under my shirt so it wouldn't get caught. Put it in my pocket. And let's say I wanted to use that 3 or 4 times a day. I would set it up for 15 to 30 minutes. It would time out when it's done, and then you can turn it on again later in the day.
They do have wireless ones too,
right?
But they're a lot more expensive,
right?
And a little more difficult, I think, to set up.
Yeah,
me personally,
it's one of those things that with time,
those
will get easier and easier.
Right, you get accustomed to it. So, how does the TENS unit work? So it works through 2 manners. One is they call it the gate theory. The electrical impulses from the machine, they actually flood your nervous system, and they cut off the pain signal, or reduce the pain signal.
Yeah. When he says flood the nervous system, he doesn't mean throughout your whole body.
Just that spot
at the location. That's why you put it where the pain is, and we do have videos to explain in detail where you would place those electrodes.
Yeah, and I've seen people. For me, I'd say maybe 50% of the people really get some good relief.
Right.
And some people, they're not so sure about it.
Right.
So it's something to try. The other thing it does, it stimulates your body to produce natural endorphins.
Sure.
And so you actually can put this on, take it off, and you might get some relief for several hours afterwards.
Right. Exactly.
Without it. So
yeah, there's the people that really benefit from this. They really appreciate that aspect of it. You turn it off and it's not done. It's almost you continue to feel the stimulation
Right after it's off.
afterwards. Yeah, it's a very interesting
But
sensation.
the one we like is actually a rechargeable one, and
Right.
so it's a little more expensive. This is the most inexpensive one. It's the 1313 model, right, Brad?
Yes. Yep. And this one you put three
You-
AAA batteries
right.
in it, and they last quite a while. But the other one you just charge it up
Right.
through your USB port. A little more handy.
They used to all have batteries,
Right.
and it's a hassle because
Back in the day.
back in the day. So, research is really indicates that it works well for acute pain. That's pain that's just presented itself suddenly,
Yep.
and it also works well on people who've had operations,
Right.
post-operative pain.
Yep. Exactly.
Little more mixed on chronic pain, but what I would say is it's so much safer and less expensive than opioids
Yep.
that I would absolutely give it a try.
Yes.
And
For
some,
sure.
some of the opioids are obviously addictive,
Hmm.
and you can become dependent upon them, or they may have adverse side effects.
Right.
So this, really is for a relatively low cost, is
Oh,
worthwhile.
yeah. I mean, you can just for a bottle of pain pills, you could probably buy
Right.
one of these or more. I just wanted to mention one case, a little case history. My uncle, who was severely electrocuted, he literally lost half of his fingers from the electrocution because his insulative gloves. It's a long story, but they melted right to his fingers and they
Oh my
peeled them
gosh.
off. But anyways, he was taking pain meds for decades. Literally, this happened in the '60s, and it wasn't until I believe the '90s when he got a TENS unit.
Huh?
And it was like, why didn't I know about
What
this
a
years
miracle.
ago? And it really helped him manage his pain because it's a chronic thing. When you have something like that,
Right. And you can use this daily, several times a day,
Sure.
and not worry about it. So they are, as you can see, small and portable. We like to use the 8080 because, again, it's rechargeable. It also has a neuromuscular stimulator. So if you want to stimulate the muscles, like
Right.
strengthen the muscles, like after you had surgery and your muscles may have wasted away a little bit,
Yep.
that it helps recover that way. So it's got two benefits, and I just think it's really easy to use.
Mhm.
Out of all of them, I thought it was one of the
Right.
easier ones to use.
Yeah. You just need to get used to that initial use of it and the feeling of it. And I personally, I think it feels good. It's
Yeah.
interesting
I had a friend
sensation.
who just had spinal stenosis, and we got it for him because
Yeah.
he had in such severe pain in his shoulder.
Okay, and that
And
was successful.
yes, it
Yeah,
was. It
great.
was. So, there's hundreds of TENS units on the market, and the vast majority work well.
Hmm.
But we like iReliev for this reason. One, many of the TENS units have really poor manuals. Have you noticed that, Brad? I mean,
Yeah, that's kind of interesting enough. But you want to have something simple that takes you
right.
step by step, and it's clear.
And a lot of them have really confusing buttons with weird images on it. Do you remember that? We got a whole bunch of them.
Yeah.
And so we've tried, again, dozens of units without a doubt. And the ones we liked is by iReliev. We like the 8080 a lot. They're simple, they're powerful, they're
Mhm.
easy to use. They come with really good brochures and booklets,
Yep.
and they also have good videos online on how to use
Right.
them.
Right.
And if that isn't enough,
There's more.
we actually did a program for this.
So what's a program?
TENS.
I know, but they don't know what a
Oh
program
yeah, okay. I see what you're doing. You're acting like devil's advocate.
is.
So you go to bobandbrad.com, go to the program section,
Hmm.
and look for TENS under that section.
Yep.
We have, I don't know, 30 videos on TENS unit.
I don't know. You made them.
Yeah, I know.
There is about it's over between 20 and 30, I believe, and it'll tell you. Say you have knee pain and you want to know where to place electrodes. Go to that one, and there you'll
We
find
even
the
show
video.
how to use the 8080.
Yep. It
So-
covers every question you'd have about a
Right.
TENS unit. Each video is about 10 minutes long. And the big bonus is there's a PDF printout that you can print it out and you have everything on that video reviewed, and it'll make your life much easier. It's a good deal. We don't even ask for your email. No charge.
It's all free.
Mhm.
And so the other thing, Brad, is iReliev products are FDA cleared.
Yep.
They're medical grade,
Yep.
so we know they're high quality. They're clinically supported. They're all natural. Again, like we said, we're going to provide you step by step on how to use them. If you decide to go with other ones, that's fine.
Right.
I no problem with that at all.
Right. The programs will work on any.
Right,
All that
right.
information is universal for TENS.
So you want to follow all the instructions: clean the skin or shave the skin in case over a hairy area.
Yeah, because that will be an issue.
And
that-
there, like I said, there are a few instances where you don't want to use it, and
Mhm.
you want to make sure you know what those are. Like,
And there's a video just on that.
yeah.
All the precautions, like a pacemaker, if you have some kind of cardiac issues.
Now you can also, by the way, he's got 2 electrodes hooked up right now.
Mhm.
You can do another set of
Right.
electrodes. So you can
Yep.
do 4 at the same time, and they have different size
Yeah,
pads.
you can cover a bigger area, or I could treat my knee
Yeah,
and
they
my
have,
shoulder
big
at the same
pads.
time.
So,
Mhm.
yep, there we go. All right. We always like to hear your comments below, or I guess see your comments, not hear them. We don't
Well,
want people yelling at us.
if your wife read them to you, then you could hear them. Doesn't she do that?
Probably not the voice I want to hear. I
Yeah,
better not say that.
we better
What's
carry
wrong with
on.
me?
Have a good day.
Yeah, take care.